Mm. Okay. Well, welcome to our webinar today, which is titled Medicare Made Simple, What's New in 2024. My name is Lee Clark, and I'll be moderating the presentation today. Before we get started, I'd like to acknowledge the generosity of our corporate sponsors who help make this webinar possible today. And I'd also like to recognize the generous support of our patients, families, and caregivers for supporting the program today. I'd like to let you know about a few other educational opportunities that we have here at the foundation. First, we have our patient and family conferences, which our last one of the year is going to be in Dallas, Texas on November the 4th. Registration is currently open for the conference on our website, which is aamds.org. Next, I'd like to let you know about our patient and family support groups. Each month, we host virtual support groups, which are welcome for patients and families to be able to join. The support groups are volunteer-led groups, so they are patients and caregivers just like you, facilitating the group, helping patients and families connect and be able to share experiences and to be able to learn from each other. Once you register for one of the groups, you do receive a confirmation email, and in that email, you will find the information to be able to log on and participate in the group that you choose. Immediately following, now let's get started with the webinar information. So immediately following the presentation, there will be a question and answer session. So please feel free to be submitting your questions throughout the presentation today. And to do so, what you'll do is look on the right-hand side of the engagement panel, and you'll see the Q&A icon. Just click on the icon, type in your question or any comment that you have, hit the enter button, and then I'll be able to see those questions. And as I said, we'll be doing the questions at the end of the presentation. Two things I'd like to ask when you're submitting the questions. First, submit your question all at the same time. Try not to send multiple pieces after you submitted the question. It's really hard to kind of piece together the question. And second, please don't share any private health information in your question. Our speaker today is not a medical expert, so will not be able to answer any questions related to your disease, treatment options. Because this presentation is about Medicare today. So I'd like to introduce Bonnie Dobbs, who is our expert speaker today. She is a writer, speaker, and founder of Insurance and Other Red Tape, which is an Atlanta-based brokerage specializing in Medicare and Medicaid coverage with agents in multiple states. After witnessing the frustration people experience with Medicare while visiting a family member in memory care, she decided to help. For the last 12 years, Bonnie has studied the program and plans relentlessly and has become a highly sought after author, panelist, and speaker on Medicare, teaching thousands online, in print, and in person. In fact, pre-COVID, she was chosen to be the Medicare expert for the Atlanta Journal Constitution's Aging in Atlanta panel series for the past 5 years. She's continued to write articles for the AJC and other publications. She was one of the top 20 senior industry experts in the U.S. featured in the latest book, Aging in Place Conversations, what industry experts have to say from the National Aging in Place Council. If you're interested in speaking to Bonnie after the webinar today, you can reach her at 770-373-7541, and her services are always free. So it's my pleasure to welcome Bonnie today.
Thank you. Can everybody hear me okay? I want to make sure that I don't have myself on mute anymore.
Yes, you're good, Bonnie.
Okay, thank you. And thank you and Nikki for having me here today. My goal is to share information with you, some general information about Medicare that you'll be able to use not only today, but going forward. So I'm going to go ahead and start the presentation. And like she said, if you will hold your questions or put them in the chat, then I'm going to try to go over every single one of them before. Otherwise, if someone could put my contact information, my phone number in the chat so everybody has access to it, that would be great. You've already gone over this information about the name of my company, but the book that I wrote, the part on Medicare about the Aging in Place Conversations, what industry experts think, is available on Amazon. So I want you guys to think of this presentation as a class. So whether you need help enrolling now in Medicare or during annual enrollment, you can call my office and get on the schedule, and know that I have agents not only in Georgia, but in some other states too. And here's the telephone number if you want to jot it down. So I'm sure you guys have seen one of these. This is your Medicare card. I call it the white card with the red and blue stripe. It has your name on it, your Medicare number on it. Part A, the start date. Part B, the start date. And beside Part A, it has hospital. We're going to go over that. And Part B. So if you only had this is known as original Medicare, and this pays 80%. Okay. Now, to be eligible for Medicare, you must be a U.S. citizen and in the U.S. lawfully. There are 3 times when you are eligible to enroll in Medicare. One is if you are turning 65. There is a 7-month period. You can enroll 3 months before your birthday, the month of your 65th birthday, or 3 months after your birthday. Now, like many of you are retiring after 65, you're deciding to continue to work. So if you or your spouse continue to work past 65, as long as your company has 20 employees or more, and that's the buzzword here, 20 employees or more, then that coverage is Medicare equivalent. If you are going to continue working past 65 and your company does not have 20 or more employees, you need to go ahead and enroll in Medicare. Now, for those of you who are under 65 and own disability, then in that 24th month, both the medical industry and the federal government agree you're probably not going to rehabilitate. So beginning month 25th, in the 25th month, you qualify for Medicare. Now, once you are notified by your doctor that you are on disability for whatever the situation may be, whether it's cancer or from having a stroke or whatever. Okay, that's the rule that applies. It's 24 months, and then you begin in the 25th month. What doctors will oftentimes do, as long as you have a past record of when you started coming to the doctor, they may take a look back and deem you disabled sooner rather than today, because the clock starts the day that you're deemed disabled. So if you're disabled today, you have to wait 24 months, okay? If the doctor said you're disabled, maybe you've been coming to him and then they realize that you have been disabled for a year, they will go back that far. There are some diseases that whenever you go to the doctor, you are deemed disabled immediately. Okay, so for those diagnoses, you can ask your doctor and he can give you the exact answer. Of course, this is always based on each individual's situation. So I know everybody gets a headache just thinking about Medicare, because not only do you have to learn about A, B, C, D, you also have to learn about penalties, deadlines, and then the different ways to get insurance. So let's go back and start talking about original Medicare, the very first slide I showed you, the Medicare card. So let's go over what is Part A, how you get it, and what does it cover. So Part A, if you look on your card beside it, it says hospital, and it covers you while you're inpatient. So it's going to pay for your coverage whenever you're in the hospital or skilled nursing or hospice. So one easy way to remember, what does Part A pay for? It pays for when you're sick and in the bed. Okay. Part B, how do you get it and what does it cover? So Part B, beside it on your Medicare card, says medical, and it covers a lot of territory. It's going to pay for your treatment, whether you're in or outpatient. It's going to pay for things like your doctor's visits, your doctor's services, medical supplies. What that means in English is when you go to the doctor, what do you need? You need for him to put on a Band-Aid. You need for him to stitch you up. You need brain surgery. You need joint replacement. It's going to pay for your doctor to do it, and then whatever supply he may need to do it with. Part B also pays for blood, diagnostic tests, biopsies, MRIs, CAT scans, etc. Durable medical equipment. Now, durable medical equipment is not just walkers and wheelchairs and things like that. Oxygen falls under that category, and so does CPAP machines. Your therapies, that's physical therapy, occupational therapy, those type things. And then Part B, drugs. Now, there's also something called Part D drugs. The difference in a Part B drug is a Part B drug is an injection or an infusion that is administered by a doctor or nurse practitioner. Okay, so Part B drugs for you guys is injections and infusions that is administered in the doctor's office or the hospital. A Part D drug is like when you go to the pharmacy, like pills, ointments, creams, that type thing. I'm pausing just a little bit at the end of each screen in case you may be writing some notes or whatever, okay? Part C is just another name for a Medicare Advantage plan. Now, Part C plans are good anywhere there's an emergency. Otherwise, they're service area specific. Now, Part C is one of two ways to get coverage that offsets original Medicare. And I'm going to go into this in more detail later on. Right now, I'm just going over what is A, B, C, D. So Part D is a prescription drug plan. Now, prescription drug plans are available two ways. You can get them as a standalone plan, or if you have an Advantage plan, they're embedded or built right into the Advantage plans. Please know all drug plans have a network of pharmacies. So each company contracts with the different pharmacies. And if you go to a pharmacy that is in their network, then you will pay less. Any pharmacy will fill your prescription, but if you go to a preferred or an in-network, your cost is going to be cheaper. So once we finish this, if you are on a standalone drug plan or an Advantage plan and you're not sure if the pharmacy that you're going to is in the network, you can either go to that website of the company, or you can call the 800 number on the back and find out. Okay. And you always, like I say, you always want to go to the pharmacy that's in the network for your specific drug plan so you get the best cost. Remember, I said if you only had original Medicare, what was shown on your Medicare card, Part A and Part B, that's known as original Medicare, and that pays 80%. Well, that leaves you owing the Part A deductible, the Part B deductible, and that other 20%. So there are two ways to get coverage to offset those costs. Now, to qualify, you must be a U.S. citizen or in the U.S. lawfully and live in the service area. So those two ways is, one is a Medicare Advantage plan. The other is a supplement plan, also known as GAP or a Medigap plans, because those supplement plans help fill in the gaps left open by original Medicare. Advantage plans do have the drug plan built right in. Supplement plans do not have the drug plan built right in. So if you have a supplement plan, you would purchase a standalone drug plan. So now I want to go over some of the characteristics of an Advantage plan, also known as a Part C. And the first thing I want to let you know is an Advantage plan is not a Medicare supplement plan. That's a totally different way of getting coverage. Advantage plans are sometimes referred to as managed care or replacement plans because the plan, not original Medicare, decides on your care, and these plans do have a network of doctors. Some more characteristics of an Advantage plan is they have all of the benefits of Part A and Part B. So remember, we went over what is covered under Part A and Part B. So if you have an Advantage plan, all of those benefits are built right in, and they usually have additional benefits like dental, vision, hearing, over the counter. They are service area specific, and they do have a network of providers. When you use your Advantage plan, you'll have a copay or coinsurance. They do have a maximum out of pocket, and they may or may not have a monthly premium. So the way an Advantage plan works is when you use it, when you go to the doctor or the hospital or need an x-ray or whatever, you'll either have a copay or coinsurance. One thing that Advantage plans has that original Medicare doesn't is Advantage plans have a maximum out of pocket. If you only have original Medicare, which is Part A and Part B, there is no maximum out of pocket. That amount just keeps on going as long as your bills do. And Advantage plans may or may not have a monthly premium. If they do, they're usually low. So now we're going to talk about some different types of Advantage plans. The most common are the HMO and the PPO. A PFFS plan, usually the only people that may get those are people that live outside of a major city, because with those plans, you have to confirm every time you go to a doctor because they don't have a network. It's just a doctor can decide to take you this time, but not next time. And then an HMO POS, they're not so common because the POS part means point of sale. And so they may or may not have some providers outside of the HMO that they accept, but usually if they do, that's very small amount. Like there was one HMO and the only outside of the POS part was just one, oh gosh, what was it? One psychiatrist chain, okay? So I want to focus though on the HMO and the PPO. An HMO means you usually have to go to your doctor, your primary care doctor, to get a referral, and you have to stay in the network or you pay the entire bill. So look on your card if you're on an Advantage plan and see if that's an HMO, because it's very important that you understand the rules so you don't pay for something and you had no idea that you were going to get charged for it. Now, a PPO, of course, if you stay in the network, it's always cheaper, but it does provide the flexibility for you to go out of the network, usually at a higher cost. So the two main Advantage plans are HMO and PPO. HMO means in-network only or pay the whole bill. PPO means in-network costs less, but you do have the flexibility to go out of the network. Now, there are specific types of Advantage plans. One we call a dual plan. A dual plan is for people who are on both Medicare and Medicaid. So if you or somebody you know falls into that category, you may be saying, well, I already don't pay for any of my medical care because what Medicare doesn't pay, Medicaid picks up. But on these dual plans, these are the ones that have the additional benefits that help puts money back into your pocket. So all those commercials that you see on TV, just remember, they're talking about the population that if you're single, you probably can make about $1,000. If you're married, filing joint, your total income could only be maybe $1,700. It differs state to state, those amounts, however, but just know you have to be low income in order to qualify. But then there are great additional benefits. And then a couple of years ago, they started offering plans specifically for veterans. Now, these plans not only offer additional benefits like maybe some dental, vision, and hearing, but also they have something called a Part B as in baby buy down. So what that means is, you know how the average American pays $164.80 this year for their Part B. Some of these plans created for veterans may only charge or may charge you $100 less. So that's like putting $100 back in your pocket. So if you know anybody that falls into that category, they can give us a call and we can research in their area. In chronic plans, this is another plan that differs state to state. In the state of Georgia, it only covers 2 chronic illnesses. That's heart problems and diabetes. In Florida, it also covers COPD. So these chronic plans are specific to the state that you live in. So I hope this helps you understand Advantage plans and then a little bit more about how they're broken down and some different options depending on your need. Now we're going to talk about the characteristics of a Medicare supplement plan, also known as a GAP or Medigap plan. And what you will find is a Medicare supplement plan is almost like polar opposite in the way you get your care and pay for it as an Advantage plan. So with a supplement or GAP plan, the first thing that's a big noticeable difference is they do not have a network. What that means is you get to go to any provider in the nation as long as they accept Medicare. Now, if you live in one state and you want to go to another state, they're not going to pay your travel expenses, but you can go to that provider and they will pay for it as if you were in your own neighborhood. You do not need a referral. So if you have a cardiologist or you want to go see a dermatologist, you just pick up the phone and make an appointment. A supplement plan does have a monthly premium, whereas an Advantage probably doesn't. And you do have a deductible. And the reason why on here I said you may have a deductible is because if you're on a plan F, as in Frank, you will not have a deductible. Now, plan Fs were, if you became Medicare eligible before or prior to January the 1st of 2020, you can still get a plan F, or if you became Medicare eligible before then, you may be on a plan F now. Plan Fs do not have a deductible. If you're on a plan G, which is the most comprehensive plan that has been available, been offered since January the 1st of 2020, you'll have this year, it's a $226, and it's an annual deductible. So the way the supplement plan works is you would pay your monthly premium. Once you met that annual deductible, should you be on a plan G instead of an F, then you would not pay for any other medical care. So there would not be like any additional copay or co-insurance. You make the monthly premium and you're done. So sometimes the monthly premium, of course, whether you can decide if you want to be on a supplement or an Advantage plan is all about budget, because since a Medicare supplement plan does have a monthly premium, you have to check your budget to make sure that you can do that, because the Advantage plans may or may not, and if they do, they're going to be smaller. So I hope that this information allows you to have a much better understanding of an Advantage plan and a supplement plan. So now we've gone over A, B, C, D, and the 2 different ways to get coverage. So now there's more rules. As with Medicare, it seems like it's never ending. I did go over the original or the initial, what's known as the initial enrollment period, and that's a 7-month period. It was 3 months before the birthday month of your 65th birthday and 3 months after. But there are lots of other periods that you guys need to remember. So if you're on a plan, if you're on a drug plan or an Advantage plan, every year During annual enrollment, which is right now, October the 15th until December the 7th, you have the opportunity to compare the plan that you're on now with the plan for next year that will begin in January the 1st. Also, and I don't have this on here, but I would like for you guys to know this information. If you're on a plan, every year during the month of September, you get mailed out to you a little form or booklet, and it's called Annual Notice of Coverage. And it may have ANOC, A not at the top, but it's Annual Notice of Coverage. And what that does is it compares line item by line item what your costs are for this year versus what your cost will be for next year. So if you've basically been happy with your plan and nothing has changed, like maybe doctors or medications, okay, you can see what the monthly premium is for this year versus what it'll be for next year. You can see what the deductibles are and the cost, okay? So this is not on the screen. I just thought about this and wanted to let you guys know or advise you about this information. During the month of September, if you're on a plan, you will get an annual notice of coverage so you can compare. If your situation or medical has changed, then during annual enrollment, that's when you get the opportunity to compare all the new plans for the following year. So if you need to change plans, if there's one that has more benefits, or if your situation has changed, of course, you may want to change plans. Number 3 is called a special enrollment period. Now, there's certain times outside of annual enrollment when you may need to change your plan. The main one is when you move, because even though Medicare is a federal, in all states, a federal program, it differs not only state to state, but county to county. So if you guys move even across the street and you're in another county, your plan may not be good there. So you would want to call a broker. Always call a broker, because a broker can compare every plan available, okay, and find out what is the best plan for your new service area. The other time, I didn't put it up here, and this is important for those folks who are on a Medicare Advantage plan. If you're on an Advantage plan and you move into a nursing home, or you're moving out of a nursing home, okay, you're probably not having a good day, right? So you do have a one-time option, whether you're in a nursing home or moving out of a nursing home, if you're on an Advantage plan, to change that plan, because I'm pretty sure your needs have changed if you're in a nursing home or coming out. Your doctors may have changed. You may be taking different medications now, and there may be another plan that will serve you better. So not only just moving, like I was talking about prior, moving, to another state or another county, but if you're going into a nursing home or coming out of a nursing home, you can switch plans. If you are losing Medicaid status or just now qualifying, that's a time when you can change plans. Or, as I talked about in the previous slide, if you have been diagnosed with a chronic condition, or you have a chronic condition now and would like to look at your options for chronic Advantage plans. What they've done with the chronic plans is, and I forgot to tell you guys earlier, with a chronic plan, they have reduced the medications for whatever chronic illness it may be. That's number one. And oftentimes they also reduce the copays whenever you have to go see a specialist. So like I said, there are certain times during the year whenever there's special enrollment periods outside of annual enrollment when you can change plans. And then the general enrollment period is every year from January the 1st until March the 31st. And I call this the oopsie period, because what that means is if you forgot to enroll when you first became Medicare eligible, or you just failed to because you just, many people think, oh, I never go to the doctor. I'm very healthy. I don't take any medications. I don't need to be on Medicare. Well, guess what? The federal government doesn't care about that. You have certain times when you have to enroll. And if you miss those enrollment periods, then they punish you by not allowing you to enroll until during the general enrollment period. So let's, for example, say you became Medicare eligible in May and you forgot to enroll. Then you can't enroll now until January. And if you enroll in January, your plan will start in February. If you enroll in February, it would start in March. If you enroll in March, it will start in May. I'm sorry, if you enroll in March, it will start in April. I don't know how I said that. However, once again, if you fail to enroll during that general enrollment period, now you got to wait till the next year during the same time frame. So not only are you going to get a penalty for the time you haven't had, now you're going to add another whole year worth of penalty to it. So make sure that you guys know when to enroll, and once you get enrolled, stay enrolled so you don't get a penalty, because penalties are for life. It's not like you can make a one-time payment or change the amounts. They are forever if you ever incur one. And then number 5 is called open enrollment. Open enrollment is something they only started a couple of years back. Now, open enrollment is also from January the 1st to March the 31st. But this is for people who are on Advantage plans only. So, say you choose your plan during annual enrollment, which is now October the 15th to December the 7th. Or if you don't do anything with your plan, it will just roll over. And then in January and February, you go use your plan, but then you realize maybe you didn't make a good decision at the time and get all the facts, or maybe something has changed with your doctors or your health in some way, and you think there may be another Advantage plan that would serve you better. You do have a one-time opportunity to switch Advantage plans, or you can drop your Advantage plan and enroll in a Part D and go back to original Medicare. If you're wanting to add and supplement, however, you'll have to medically qualify if you're outside of your grace period. So you'll want to make sure that you use a reliable broker who can lead you through that so that you don't end up getting a penalty. So these are important time frames. Let's talk about low income for a second. So extra help is also known as LIS, which is known as low income subsidy. Now, qualifying all depends on your income. If you do qualify, if you do have low income, then your drugs are offered at a reduced rate. So if you want to find out if you do qualify, call the 800 number on the back of your insurance, not your Medicare, but your insurance card. So if you're on an Advantage plan, you'll call the 800 number on the back of your Advantage plan. If you're on a supplement plan, you'll call the 800 number on the back of your standalone drug plan. This is for the state of Georgia only, okay? There's 4 different levels of Medicaid in all states, but for the state of Georgia, this is the monthly income and the resources, whether you're single or married, filing joint. Please note your car and your home are not considered resources. Resources is like cash on hand or CDs, that type thing. If you're in any other state other than Georgia, this does not apply to you because every state has its different monthly income levels and resources. So you can go to Medicare.gov and check on the different levels of Medicaid, or you can go to the Medicaid website in your state to see if you qualify. So we've talked a little bit about low income. Now let's talk about the opposite end of the spectrum. Let's talk about high income individuals. And what is IRMA? IRMA is income related monthly adjustment amount. And so for 2024, because there's always a 2-year look back on your MAGI, your modified adjusted gross income, they're going to be looking at your 2022 taxes. So you can make up to, this is for next year, okay? You can make up to $103,000 if you're single, or $206,000 if you're married, filing joint, and you'll pay $174.70 for your Part B. Now, please note, there is an escalating scale in different increments up to $750,000 or more. So depending on your income and where you may land on that scale will depend on how much extra above and beyond the original Part B that you will have to pay. There's some changes that happened actually last year that are rolling over to next year. And number one is all calls are recorded and must be kept or housed for 10 years. And number two, this disclosure below must be announced at the beginning of every sales discussion between the agent and the client, and it must be listed on all marketing materials. And it says we do not offer every plan in your area. And then it also, whenever we're reading it, it tells you how many companies that we're contracted with and how many plans are offered. Now, I have a little issue. Well, I have a big issue with a lot of this, all of this, okay? But number one, the reason why I don't offer every plan available is honestly, some of these companies are not worth your time or mine. Example, I'm never going to put my clients with a company that's not established and dependable. Okay, if they have not been in business for at least 4 years or more, there's nothing to prove to me that they're going to be in business. It takes a company a long time to get established in the Medicare market. That's one thing. The other thing, because I use 2 different systems, like it says on one system that I have 5 companies with so many, like, I don't know, it could be 100 plans. With another system, it says I have 4 companies with so many plans. That is so misleading and it's confusing to everybody. Okay, I'm sure it's confusing to you guys too. These requirements are in direct response to those misleading TV commercials in the past. And so reputable agents, we're offended, and I'm sure you guys are too. You're not really happy about having all of your information be recorded, and kept for 10 years. So let's talk about prescription drugs for next year. The federal government has raised the annual deductible. So this year it's $505. However, starting in 2024, the most any drug company can require for an annual deductible is being increased to $545. They are eliminating the catastrophic phase of the donut hole, okay, or the different phases of the drug plans. So this year, once you go in the donut hole, where that's the part where you're paying 25% for brand or generic, once you have paid up to $8,000, then for the remainder of the year, you will not owe anything. Okay. Now, according to the Inflation Reduction tax bill that was passed last year, in 2025, the maximum out-of-pocket cost is supposed to be $2,000. This is for your co-pays. Now, that's music to a lot of people's ears, you know, because people do pay like up to $8,000 for their medications. So I just say, stay tuned. You know, they also told agents that in 2018 and 2020, the donut hole was going away. And guess what? Here we are into 2023. The donut hole has still not gone away. So I'm just as excited to find out what's going to happen in 2025 about the maximum cost of meds being $2,000 as you are. One thing I would like to say, if they do that, I'm also interested to find out how much they're going to increase the drug plans and the deductible. So the deductible for 2024 is going to be $545. This time next year, let's see what happens, okay? So Part A premium and deductible for 2024. The way you guys get your Part A is by working for 40 quarters, which is equivalent to 10 years. So if you work 10 years, equivalent to 40 quarters, you get Part A for free. If you work up to 30 quarters, between 30 and 40 quarters, okay, then you'll have to pay a premium in 2024 of $278. Now, the Part B premium next year will be $1,632 per benefit period. So what that means is if you didn't have a plan, if you didn't have an Advantage plan or a supplement plan, and you went to the doctor, you went to the hospital in January, you'd have to pay $1,632. Then you come home and then you go back 2 months later, you're going to have to pay the $1,632. That's the reason people like to get either an Advantage plan or a supplement plan to help offset the Part A deductible, Part B deductible, and other 20%. So most Americans have worked for the 40 quarters or 10 years. So there is no Part A premium. So when they become Medicare eligible, oftentimes they will hear Part A is free. Well, no, it's not free. You paid for it all those years. You paid into, it's called FICA taxes. You paid into FICA taxes. It's just when you become Medicare eligible, if you did pay into it for 10 years, then there's no additional premium. For people who did not pay into it, that's the folks that have to pay the $505 premium. This year, the Part B premium is $164.90. So if you're on Social Security, they're deducting that from your Social Security. If you haven't started Social Security, they send you a bill in the mail and you pay it quarterly. Okay. For 2024, they just released those figures this week. it's going to increase up to $174.70. So starting in January, your Part B will be $174.70. This year, the Part B deductible is $226. Next year, it'll be $240. So for all of you who are on a Plan G, if you have a supplement plan, if that's the way you're getting your coverage, starting in January, your deductible for next year will be $240. So I hope you guys have a better understanding of Medicare at this point. There is a couple of things I do want to go over with you. It doesn't cost anything for a plan review or for us to help you in enrollment. The way we get paid is, first of all, the commission is already built into these plans. So if you call a company direct, they just pocket that commission. Or if you use an agent or a broker, and I strongly advise everybody to use a broker because a broker can compare all the plans that's available, then the broker or the insurance company gets paid that commission. And it's a standardized commission, so we don't have any incentive to put you on this plan versus that plan. But one thing I want to go over, and then I'm going to open it up. Can somebody tell me what time it is? For some reason, it's not showing on my screen. Okay, never mind. I see it's 2:55. Okay. What happens if I'm on an Advantage plan and my provider goes out of network? Remember, if you're on an HMO, it will, you have to pay the whole cost. If you go out of the network, if you're on a PPO and they go out of the network, you'll have to pay the higher cost. So those of you who are on Advantage plans, please look on your card and know those rules. If anybody calls you on the phone and say they work for Medicare, no, they don't, because Medicare is never going to call you. The IRS is never going to call you. Social Security, none of those people are ever going to call you. They're going to contact you through the mail with a letter. So if somebody calls and tells you that they're with that, just hang up on them because they are not telling you the truth. Okay. At this point, I'm going to stop sharing. Oh, please know, my company, the third bullet there, we are not affiliated with the U.S. government or federal or state Medicare or Medicaid programs. Okay, so does anybody have a question that you need to ask?
Sure. Thanks so much, Bonnie. One of the questions that we have is, oops. Sorry. It says, I spend 4 months in the winter in a different state. What do I need to do when considering choosing a plan?
If you're on a Medicare supplement plan, the ones where you make a monthly premium and it's in your plan will be like a plan F or a G or N, it'll have a letter. Okay. If you're on a supplement plan, you can use those plans anywhere in the United States. You just have to go to providers that accept Medicare. Okay. If you are on an Advantage plan, some of the plans have out-of-network benefits. So it's important to find out if the plan that you're on does have the out-of-network benefits. So whenever you do go to your beach house or to stay with your children or whatever the case may be, that you can get care there. With Advantage plans, okay, outside of your service area, though, they are usually always only good for an emergency, which is a good thing because as a rule, if you go on vacation, you're not going to go to the doctor, or you hope you don't get to have to go to the doctor. So the only time you would go is if it wasn't to be an emergency. So Advantage plans are good anywhere you have an emergency, but as a rule, they're only good in your service area. Some of them do have a travel benefit, so you'll want to call the 800 number on the back of your specific insurance company and ask them if they do. If they don't, then you'll want to call a broker and get somebody to research all the plans to find out which one would have it in your area, and then also in the area that you're traveling to.
Thank
That's
you.
a great
Bonnie.
question. Yeah.
Our next question is there a good option for is there a good option for dental treatment?
No. Some of the Advantage plans have a network of doctors. There may be one or two companies, and all of this depends on where you live, what state you live in. Okay, some of them may have their dental plan may be a reimbursement, like when you go to the dentist, you pay for it, and then you send them the bill, and they reimburse you. Those are the best kind if you can get it, but if not, then you have to go to their network of dentists. And sometimes that's where people get really upset because they want to go to their dentist. But that's if you have your dental plan embedded into an Advantage plan. Now, if you want to get a standalone dental plan, usually those will have a monthly premium. They will have, usually it's either a $50 or a $100 annual deductible, and then they will pay a percentage. Okay, so those are very, very specific also per plan.
Thank you, Bonnie. Our next question is, I'm currently working and hope to retire in a few years. When should I enroll?
We always like to start working with somebody 3 months before. That way we can take you step by step and only give you one piece of homework at a time. So you're actually learning about the process as you go through, rather than giving you a laundry list, of things to do and trying to cram everything into a very short period of time. Because it's important, number one, that you learn all these different phases, but number two, that you fully understand the two ways to get coverage, and then how is that insurance going to work with your Medicare? And then the big thing about if you choose an Advantage plan, about the HMO and the PPO, okay? Because it's what you don't know that can oftentimes, really hit you in the pocketbook. So we like to work with people 3 months before. If you work for a company that is going to offer you benefits, insurance benefits once you retire, you'll want to contact somebody in the HR department or benefits department so that they can explain all of that to you. Now, in the past, I would say do that and forget it. Not so much anymore, because so many large companies, just like, everybody in America, they have also had to increase their annual deductibles and their monthly premiums. So many people will give us a call and say, my company's retiree plan, they're charging me this much per month, and this is what the annual deductible is. Those are the only two figures we need to know. We don't need to know what your copay is for the doctor or any of that. That's minutia. 2 figures: monthly premium, annual deductible. And then we can tell you if that is a better situation and strongly advise you to stay with your company, or if you can get more benefits for a least amount out of pocket by doing an individual plan. But one thing, and I want you guys all to hear this is really important. If you're on a retirement plan and you ever come off, they're not going to let you back in. If you ever are out of the nest, they're not going to say, oh yeah, come back and we're going to pay for your coverage. Because if you're out, then they're going to save all the money that they would have paid for your insurance premiums, right? So they're not going to let you come back. So you really need to talk with somebody who can give you exact information on monthly premiums and annual deductibles, and make that smart decision, okay? Because if you do come off, you're employer coverage or your retiree plan rather, then you can't go back.
Thank you. And Bonnie, our last question is, do you have to sign up for Medicare at 65? And if you do not, are there a penalty, or is there a penalty?
That's a good question. I address that. If you or your spouse works for a company that has 20 employees or more, you can delay enrolling in Part B. If you or your spouse are not working for a company that has 20 employees or more, you must sign up. And if you don't, you're going to get a lifelong penalty. So as long as you or your spouse is working, 20 employees or more, you can delay it. Otherwise, you have to enroll now. The other thing that sometimes people do, and this is, I mean, I just answered your question, but I want to add something to this, is people will sign up when they turn 65, even though they or their spouse is continuing to work. There's no need to do this. Please don't do this, because you're going to start paying that Part B monthly premium every month. And it's like taking that money and throwing it out the window, because the federal government is not going to reimburse you or pay you back whenever you realize you've made a mistake. So it's important, very important, to remember, enroll when you're turning 65, unless you or your spouse have a job with 20 employees or more, and they've got credible coverage through their company, because there's no need in enrolling in Part B if that is the case. But if you don't have anybody working, definitely enroll so you don't get a lifelong penalty.
Well, thank you so much, Bonnie, for sharing your time and your expertise with all of us today. And if you'd like to watch this webinar again, it will be available on the conference platform within the next hour. It'll also be available on our website within 7 to 10 business days. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today, making us your resource of choice for information related to bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 40 years. This concludes our webinar. Thank you again, Bonnie.
Thank you. Thank you for having
me.
I greatly appreciate you.
Take care.